Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us here on the program today. Our guest is Dr. Graham Dixon. He's CEO of Neem Biotech, and he's joining us on the program today to talk about the American Society for Microbiology Conference on Biofilms and the North American Cystic Fibrosis Conference on a new way to enhance antibiotic effectiveness. And I'll let Dr. Dixon introduce himself, give us a little bit of background, and talk about the data at these two conferences. Welcome to the program, Dr. Dixon. Thanks for taking the time.
It's a pleasure, and it's nice to be able to talk to you about our company and our data. Neem Biotech is a company based in Wales. It's been around for about 20 years, but established itself as a CRO originally, working on natural products and extraction methods. And through that expertise, that building of the expertise, we learned about the chemistry of these products, and then we subsequently studied the biology of some of them. And it was from that history that we then focused in on compounds that could have an impact in overcoming antimicrobial resistance.
Now, that's a huge unmet medical need, this microbial infections in these wounds. Are these wounds, they just won't heal, or is the bacteria the reason that they won't heal?
Yeah, these are called chronic wounds. So they are wounds that don't heal over a certain specified time period. They're a big burden, obviously, to the patient in terms of morbidity, but they're also a big drain on the budgets, the healthcare budgets. And really, it's well established that the bacterial infections you get in the wounds, and also the biofilms, so the extracellular protective matrix that they produce, is actually contributing to the inability of that wound to heal. So it's a huge problem. Yeah.
So something that is produced naturally in the healing process is preventing the wound from healing. Is that what I'm to understand?
No, it's the presence of the bacteria. They produce toxins and things like that they secrete that prevent the wound healing, so they interfere with the immune system. The actual extracellular matrix, so this biofilm that they produce, also prevents the bacteria from being accessed by antibiotics, for example. But it also prevents the immune system from clearing the bacterial infection as it would normally do in healthy people. So there's a number of factors that contribute to the fact that this stops the wound being able to heal properly.
So what is the solution for these non-healing wounds?
Well, at the moment, they're treated with a standard of care, which includes the use of antiseptics. That's usually incorporated into the dressings that are used to treat them. When the infections get quite serious, and certainly if they have the potential or have gone systemic, so into the blood system, then they use oral or IV antibiotics. However, they don't necessarily help to cure the infection in the wound. So our approach is to look at non-traditional antibiotics. So we're looking at bacterial virulence, which is triggered by a process called quorum sensing. And quorum sensing is actually the way that bacteria communicate to each other through the secretion of chemicals. And so that they use that to be able to tell whether they're very close in proximity, whether they get into a certain cell density, and that then triggers the production of this biofilm, etc. So we're approaching that virulence aspect to be able to get rid of the biofilms, and therefore we will allow the antibiotics to do their job. And we've shown very nice data, actually, in both these conferences that we've been attending here in the US, that we can actually achieve that clearance through use of antibiotics in cystic fibrosis in lung as a situation, but also in the chronic wound setting.
Are you far along in your development of this product?
Yeah, well, we've got two separate products. So the original products were inspired by compounds from garlic, actually, where we understood the biology. But we've now taken those natural products and we've completely synthesized them. So we've improved those molecules by medicinal chemistry, synthetic chemistry. So we now have separate compounds for the two indications. The wound indication is slightly more advanced than the cystic fibrosis currently. So we're in the preclinical development stage. So we're preparing, we're scaling up the chemistry. We're doing the development of the formulation, which in this case for wounds will be a topical formulation. And we plan to enter into the tox required, the GLP tox, during next year. And then we would be in the clinic in patients in early 2020. With the cystic fibrosis, we are in the process of final optimization of our clinical candidate. We should have that by the end of Q1 next year. And therefore, we plan then to be in the clinic in cystic fibrosis probably by the end of 2020.
So what do you see on the horizon after these accomplishments, say in another year or so for Neem?
Yeah, and I think, well, the exciting part for us is now, as for many biotechs, is taking our preclinical work, which we've got very nice data to suggest it works preclinically. So in skin models, in lung models, etc. So we can't take it any further in preclinically. What the exciting part now is to go forward and show that it works and benefits patients in the clinic. So the idea is to move forward and show a proof of concept in these different indications in the next 1 to 2 years, which will be a great development for the company and very exciting, obviously, in terms of what we can bring for patients. Now,
just to be clear, you are the first company that's been focusing on this antimicrobial treatments for these two key areas. Is that correct?
Well, we're not the first, but there's not that many. And we actually approach this quite differently. So many of our competitors that are out there focus on a single effect that can easily be overcome by the bacteria. We are focusing very broadly because we're targeting this process called quorum sensing, the communication system. And we've shown, again, in the data presented that this affects many aspects of the bacterial virulence. So we're actually taking a very broad approach. So therefore, there is more chance that ours will work. And it's also more flexible in terms of how it can be used in the clinic. So we see ourselves as being clearly differentiated from the handful of competition that's out there taking a similar approach.
But where can we go and learn some more about Neem Biotech?
Well, we have a website, so you can go through onto the website. We have our publications are on there that we've presented, the posters, access to that. So I think that's probably a good place to go to learn.
And that would be Neem, Neem Biotech.com. Is that correct?
That's correct, yeah.
NeemBiotech.com. Well, thank you so much, Dr. Dixon, for coming in and speaking with us this morning. I know that you've got a lot more to get to because you're actively in the conference as we speak. So I thank you for taking the time out of your schedule and joining us on the program today. It's been a pleasure.
Okay, thank you very much. It's been a pleasure too. Bye-bye.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Graham Dixon, CEO of Neem Biotech. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. Subscribe to the podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.